Hi, everyone. Welcome to today's session with Chris Croft. We are excited to have you all here for today on the last day. My name is Alana. I'm on staff with Freedom Network, and I'll be doing the technical help on the back end. I wanted to give some logistics before we begin. So this session is eligible for CEU credits. We will be putting the codes into the chat box as the session goes on, so be on the lookout for those codes. If you have any questions, you may reach out to me or our other volunteer, Medina, in the chat box privately. We will help you the best way we can. This is a meeting and not a webinar, so if you're not speaking, make sure that you are muted. We will allow for unmuting when it's time for question and answer at the end. We do have an evaluation that we will put the link for at the end of the session. We would appreciate any feedback you have on today's session, would be very valuable for us. And if you have any questions throughout the session, please put them in the chat box. We will have them compiled for our Q&A later on. And now I will hand it over to Chris for today's topic.
Hi, everyone. Thank you for being here with me today. I'm excited to be here at Freedom Network presenting, and I'm grateful to you for being here and spending some time with me. Let me go ahead and share my screen. Okay. So today's session is externalizing the violence, shifting from boogeymen and bad guys to our collective responsibility. I do have my contact info here, and I'm happy to share it in the chat throughout if y'all have any questions. I am more than happy to follow up in dialogue about this. I am the Prevention Education Program Manager at the North Carolina Coalition Against Sexual Assault, and we are an inclusive statewide alliance working to end sexual violence through education, advocacy, and legislation. We use a social justice framework in all of our work, trying to do our work from a strong intersectional social justice perspective. We know that when we don't intentionally center marginalized communities in our work, that their needs don't get served, their voices aren't heard, so we try to center our work around marginalized communities to make sure we're serving everyone. My pronouns are they, them. My name is Chris, and in addition to working for NC CASA, I also am a member of the Heal Trafficking Speakers Bureau, a member of Freedom Network. And I do want to acknowledge that today's presentation draws in different places on some really amazing Black Studies scholarship. And I am, as you can see, a white person. So I want to acknowledge that my positionality impacts my perspectives, and that my perspectives are necessarily limited by the way that I move through the world as a white person. So I'm hoping that I am using this theory, these ideas in ways that are in integrity with the intention with which they were meant. This is drawing heavily on a Black Studies scholar named Alexander Wahelier, who is drawing also heavily on Hortense Spillers. So acknowledgement and credit to them for the work they're doing and how that has informed the way I view my place in the trafficking movement and the trafficking movement's place in our world. So every time we see some big crisis or some big human rights atrocity, it seems that there are no shortage of people who are quick to say, this is not who we are. This is not who this country is. This is not who we are as people. This is not who we are as representatives of whatever group or identity we belong to. We want to separate ourselves from it and claim that we are somehow separate from this extreme violence. And this includes human trafficking, right? We want to separate ourselves from being identified with that kind of exploitation or harm or oppression of other people. I think for me, I want to start with just like what a broader definition of violence is. My understanding of violence is very much in alignment with this definition that I found from the World Health Organization's Violence Prevention Alliance. And they define violence as the intentional use of physical force or power, threatened or actual, against oneself, another person, or against a group or community, that either results in or has a high likelihood of resulting in injury, death, psychological harm, maldevelopment, or deprivation. So they're looking at violence more broadly, and some of the key pieces to this are that it's intentional, that it's use of physical force or power, threatened or actual, and that there's different levels that it can happen at, individual, interpersonal, or societal. And that it has a high likelihood of resulting in injury, death, psychological harm, maldevelopment, or deprivation. And so by maldevelopment, y'all feel free to throw anything you want in the chat about that, but I'm thinking of maldevelopment meaning like depriving groups, regions, people of having access to the kinds of economic development, personal development that could help them live fulfilling lives with well-being. So the Violence Prevention Alliance notes that it can fall into one or more of these categories. And so they include self-directed violence, which would include things like suicide or self-harm, interpersonal violence, which they say can be either family or community violence. So family, we think about intimate partner, child abuse, child maltreatment, and then community violence, we're thinking of things like stranger violence, violence in neighborhoods. And then they refer to collective violence. And when they talk about collective violence, they're referring to violence committed by larger groups of individuals, and they subdivide that into social, political, and economic violence. So looking at even, and we talk a lot in our trafficking movement, I do hear a lot of conversations about economic coercion, but even when we talk about economic coercion, we're often limiting ourselves to talking about things like a trafficker keeping control of someone's finances, their checkbook, their documents, their money, their income. We don't tend to think about these on a broader collective scale. So most of our presentation today is going to focus on this collective violence and what that means for the human trafficking movement. If we're genuinely committed to being anti-violence, then we're going to have to broaden up how we're thinking about violence and also how we're thinking about prevention. So I was thinking about risk factors and violence while preparing for this presentation, and some of the risk factors that I've seen in different pieces of literature in the human trafficking movement, some of the different risk factors for trafficking have included things like poverty, gender inequality, stigmatization of precarious labor, immigration status, community and cultural norms that normalize exploitation, exposure to criminal behavior and violence in communities. Sometimes I see compromised parenting or caregiver strain mentioned, systems involvement, prior trauma, lack of safe housing, and involvement in precarious or criminalized labor. And these get bounced around as if they're risk factors that just sort of like popped out of a vacuum. When we have conversations in the human trafficking movement about preventing violence, preventing human trafficking, a lot of times we hear them name these risk factors and how they contribute to someone's vulnerability to human trafficking, but we don't then turn around and look at how we prevent or address each of these things on their own as existing forms of violence. And maybe they're not all existing forms of violence. So I'm going to give y'all an activity where I'm going to break you out into breakout rooms for the next 10 minutes. And I have a Jamboard link that I'm going to share with you in the chat so that you can access some of these risk factors. But I want you to go through these factors with your group and maybe pick, you might not make it through very many of them depending on how rich the conversation is, but pick a few of these risk factors and kind of see if you can come to some agreement within your group. Is this risk factor itself an example of violence according to this definition? Is it an example of injury, death, psychological harm, maldevelopment, or deprivation against a person, group, or community? And is it intentional? Intentionally caused by actual or threatened force or power? And again, when I say intentional, it doesn't have to have the intention of enacting violence to have the impact of enacting harm. Is the policy itself an intentional policy? Is the practice itself, the phenomenon itself, was it created intentionally, even if the impact was not initially to create harm? And then discuss that, and what arguments would we have for considering that risk factor to itself be a form of violence? What arguments would we have for not considering it violence on its own? And for the ones that you decide are violence, I want you to consider, do you typically hear them framed as violence in most anti-trafficking messaging? And if the answer is no, typically these are not referred to as violence. They're referred to more as a social condition or a cultural norm. I want you to think about why that is. Dig into like, who are the people we're talking about? Who are the communities and neighborhoods most impacted by this? Why is it not normally framed as violence if it's not? All right, so I got some feedback that it was hard to see the Jamboard, so I'm actually going to bring this into the whole group for a moment. And I think I want to ask one of these risk factors that we're looking at. Let's pick one. Somebody who, Erin, since you jumped in to alert me to the fact that the Jamboard wasn't showing and it was confusing, why don't you pick one of the risk factors?
I'm going to pick stigmatization of precarious labor.
Okay, so I think my first question is looking at our definition that we have in the chat, and I'm going to open up the chat, the questions we had about it. Is stigmatization of precarious labor some sort of, well, we know that it's not injury or death, we're not going to put it there, but is it an example of psychological harm, maldevelopment, or deprivation?
Yes.
Would y'all say yes? Okay.
Oh, I would say yes. I'm sorry.
Yeah, anyway, y'all jump in.
Good answer.
Let's do this together. We're gonna have the biggest breakout group in the history of a conference. Okay. And then against a person, group, or community, is it intentionally caused by actual or threatened force or power? Let's talk about that in a minute. Does someone want to share some thoughts on whether or not they think it's intentionally caused by actual or threatened force or power?
Well, I think yes, because as a I guess as a society, we have the laws that we put in place. We have the power in constructing those laws. So when we talk about when we look at people who do what we consider jobs that are not the norm, and we put a label on them, or there's a law against them, then we have the power, I think, as a country, when we make laws such as that. Not we, because they won't let me make any laws because my laws are different. But
that is unfortunate. I don't know if anyone else ever feels, but it's an unfortunate fact that some of us do not have more power to make laws than we do.
yes.
When we talk about anti-trafficking and ending human trafficking, do we often hear people talk about stigmatization of precarious labor as a form of violence?
No.
Maybe in some subsects of it, right? But in general, we don't talk about that as being violence. It's brought about as just this thing that exists in our culture and this thing that happens. Why is that? And again, we're looking at who is doing stigmatized or precarious labor, right? They're also not writing the laws for the most part. They also don't have cultural, social, or political power. So someone else who maybe hasn't spoken up yet, pick a different risk factor for me. Let's pick another one of these. And they may not all be forms of violence. I really didn't know when I put them up there. I just thought we'd have a good, I know a few of them are. Someone else pick one, and I'm having trouble following in the chat.
I would like to pick undocumented immigration status.
Yes, okay. So undocumented immigration status, and we're gonna go back up, and is that an example of injury, death, psychological harm, maldevelopment, or deprivation?
Mom's camera.
Yes.
Yeah. Is it intentionally caused by actual or threatened force or power?
Yes.
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 Right. The harm that comes from it is, even though someone's actual status may not, like they didn't create a status out of harm, but that status was imposed on them through this system. Do we tend to hear things like immigration status referred to as an example of violence in the human trafficking movement? No, because it's collective violence. And this movement has from its beginning been so focused on this individual understanding and conceptualization of violence, because it's been informed by the criminal justice system. And we tend to not prosecute whole collectives. We tend to not prosecute ourselves as a culture or our government as the creator of these policies that harm people. And again, if we get to why do you think that is, who is impacted by this form of violence, and are they the ones creating the laws and powers that create harm against them? They're not.
I think,
go ahead.
I think also violence, it would take a while to understand violence in this more fleshed out definition. Just like people are having a really hard time understanding hate crimes in the most recent awful set of shootings in the Asian parlor. They're like, he didn't hate the women. You're like, well, hate crimes is not actually sort of a conventional definition of hate, right? This is a very unconventional definition of violence. And it is one that I think is very familiar to people who work in human rights and who look at systemic situations, but we're a country that is very focused on law and order and affirmative violence. And we sort of see things very simply with respect to violence. And so I think that part of the problem in sort of construing it that way is that we see this as a systemic issue, and not sort of something anyone's doing to anyone else. And on the immigrant issue, I'll point out, I have very little faith in any of the numbers that we have on trafficking, having been in this field for 20 years and seeing the sausage making. But there are good numbers on immigrant labor trafficking from a 2014 study. And we do know that, at least in agriculture, 80% of employers in that study, which is the largest study of labor trafficked agricultural workers, were American employers, and 50% of all other immigrants who were found to have been labor trafficked were Americans. So that's really important, because that tells us that we as a country are complicit and we're all benefiting from it. So I think that helps sort of drive into the shared responsibility, at least.
Thank you for sharing that. So if maybe someone who hasn't spoken yet wants to pick one of these, we'll do one more in the interest of time. So if someone who hasn't spoken yet wants to pick one more of these risk factors, and let's just figure some of this out together.
Have you chosen lack of safe housing yet?
No, we haven't. So who is that? Oh, okay. Hi, Tara.
Hey.
Good to see you. I know Tara. Tara and I are both in North Carolina. So let's go through and see about whether or not lack of safe housing is a form of violence. So is it an example of injury, death, psychological harm, maldevelopment, or deprivation? Anyone? Kind of share your thoughts. This might not be a yes or no answer on these. You can give some complex answers.
I feel like it can be. I mean, if you have no safe housing, you're open to the elements, you're open to being attacked, you don't have enough resources, or you might actually be living with someone, which is a different type of situation, and it's not safe for various reasons to be with that particular group. So, yeah.
But I also think, to add to that, the level of hypervigilance, being in survival mode, the toll it can take on mentally could result in being a form of violence. So I would agree with that.
Yeah, I also think that, lack of housing is, connected with poverty, and also, who has access to safe and stable housing and who doesn't, right? And I think that especially here in Seattle, we have a really huge homeless epidemic that has gotten even worse since COVID. And I think that a lot of those folks that are suffering from homelessness, that it's intentional, as far as, like historically, who we decide gets to live in certain areas and has access to housing and stuff. And it definitely does affect their livelihood, their mental health, whether or not they experience violence at a high rate, sexual assault, all the things. And so for me, my perspective is that it definitely is a form of violence.
How many of you have ever heard anyone in a training before refer to homelessness as a form of violence?
None.
I can only see.
Never.
Never.
Yeah, me either. And I'm on my county's, until recently, I was on my county's homelessness board, and I had never heard it framed that way, except among some homelessness activists who you hear say that it should be criminal that we have as many people homeless as we do while we have spaces. Right. And I've heard that brought up, but those are more among activist circles and less among like the nonprofit sector and the anti-violence world. I'm going to go back to my slide. Thank y'all for being patient when the breakout rooms. I did not realize Jamboard had a limit to how many people it would let look at it at once. So I appreciate your patience, and I hope that we just made up for it in our giant breakout room together. Here we go. I'm going to be clear with y'all. I had not heard of any of these things referred to as violence either. I was just reading this theorist that I was reading, that I read in grad school a while back, and I was like, this is so relevant to the anti-trafficking world, and I'm not entirely sure how, but I bet if I get 100 really smart people in a room with me, I'll figure it out. So this is just looking at collective violence and individual vulnerability. So systemic and community issues impact individual risk factors for populations at increased risk for human trafficking. So a lot of times you'll hear people say, you know, that someone's race, someone being Black or Native, is a risk factor. But the reality of it is the societal risk factor is racism and colonialism, that these impact people in terms of just society and culture, but also in terms of government and policy, and especially when you look at historical trauma and historical impacts. And someone mentioned the intentional housing policies around who got access to housing and who didn't, and who got funding for home improvement and other home financing and who didn't. You'll hear again, people, y'all mentioned immigration status, when the reality is xenophobia and immigration policy are the risk factor. That if we found some magical way, which I'm not sure what the answers are, but if we found some magical way to address xenophobia and fix our immigration policy, someone's immigration status would no longer be a risk factor for trafficking. Again, we talk about statistics among LGBTQ youth, and it's high for lesbian, gay, and bisexual cisgender people, but it's even higher for trans people. And it's even higher for trans people of color, especially if they have an undocumented immigration status. Like, these layer and interact on people in unique ways, not just in an additive way, but like someone who is lesbian, an undocumented trans lesbian is going to have an entirely different experience of like racism, documentation status, and transphobia than a white trans person, right? So they intersect. But again, it's not because that person is LGBTQ that they're at higher risk. It's because of homophobia and transphobia in our culture. We hear a lot of times referring to criminal activity in neighborhoods. And this is one when I've been on groups of people, multidisciplinary groups, writing out risk and protective factors. We go back and forth about how to word this one, because we are so conscious that the neighborhoods having these disparities in crime rates and income, poverty, that's a result of redlining and structural racism. So we don't want to present criminal activity in neighborhoods as if it's some magic risk factor that exists in its own little bubble. It's an integrated part of this whole system, right? If there had not been this history of redlining, if there was not structural racism, then these neighborhoods would not be neighborhoods where people are considered to be more at risk to exposure to criminal activity. And we can even look at that on a global level when we start looking at things like, what is US foreign policy? How have we gone into other countries and intentionally and systematically destabilized other countries to create areas of this world in which there is increased violence, increased criminal activity, increased vulnerability to trafficking, when we can trace it back to a lot of times white Western countries' intervention with regard to their foreign policies. And again, prior trauma is frequently brought up as a risk factor. And that one frustrates me because, first of all, it's not deterministic. Just because you have prior trauma doesn't mean you will be trafficked. And we sometimes talk about it as if it does. But a lot of times that prior trauma, if we really dig deep, can be traced to things like family poverty, lack of mental health supports, caregiver strain. Maybe there's a parent, and we don't at all excuse child abuse in any way. Child abuse or maltreatment is not okay. And also, we could be asking ourselves why that parent is working all the time and struggling and can't get mental health treatment that they need, to the point where they're losing their patience with their kid and not really able to manage. They don't have the spaciousness that they need to do their own healing, right? So we can look at these as systemic and societal risk factors. We can go through these one at a time and just think, like poverty. We can ask ourselves, do our economic and workplace policies contribute to harm, maldevelopment, deprivation of certain groups? And again, think about our safety nets. How many hoops do you have to jump through? And again, I'm speaking from a US perspective because I'm in the US. I'm not as familiar with other countries' economic systems. But I know that in this country, if you want to get government support and financial assistance, there are hoops you have to jump through, and you don't get that support because you are so poor that you are appropriately pitiable. right? That's the only way that they will support you. And are our economic policies intentional? Yes, they didn't just fall out of the sky on tablets. People sat around and discussed and debated them and decided this was a reasonable strategy. And then what's the actual or threatened force or power? You know, part of the force and power is fear of homelessness. You don't want to be evicted. You don't want to lose your home. You don't want to be hungry. You want to be able to feed yourself. Poverty is itself oppressive and violence. Lack of safe housing, I know we talked about during our discussion earlier, and our housing policies contribute to harm, maldevelopment, deprivation of certain groups. And you think about things like low barrier versus high barrier housing. A lot of times the shelter options that people have in their community are so high barrier that they're not realistic. There's not enough beds. And then if there is a bed, there are certain standards you have to meet, which mean that even the most vulnerable people who are at highest risk for trafficking often can't get into shelters. And our housing policies are intentional, right? These didn't just fall out of the sky. These are the result of like discussion and debate, and we try to reform them and we try to make them better, but they're still carrying forth this legacy of collective power and control, right? Those of us who've done SADV work know about the power and control wheel, and there's like a collective power. I want somebody make a collective power and control wheel for me. Maybe that already exists. Maybe I should make it. Again, we look at homophobia and transphobia. Do our housing, healthcare, family, and limited non-discrimination policies contribute to harm, maldevelopment, and deprivation? Yeah, you take a look at the suicide rates among LGBTQ and especially trans youth, and you can see that these policies contribute to maldevelopment, deprivation. Religious discrimination can contribute to that because oftentimes religion is where people get their meaning, their sense of meaning in their life and their community, and that's where a lot of the safety net comes from. And in the trafficking movement and in a lot of other social service movements, especially in rural or southern areas, we see that that's where a lot of the social services are provided by. And these policies and practices, again, are largely intentional, you know, and it may be that someone themselves is not intending to judge their child or their partner or their friend, their family member, but there's this history of intentionally framing homosexuality, being transgender, they're getting framed in a specific way on purpose. And a lot of times people who don't realize how these narratives are being spun and by whom hear them and take them on, and it ends up causing harm to people. So think about this as you're looking at risk factors in your handouts, your brochures, your presentation, your logic model. Think about these different policies and practices and be like, does this systemic policy or social and cultural practice cause harm, maldevelopment, or deprivation? And is it intentional? And what's the actual or threatened force or power? And when we do this, if we were to go through our risk and protective factors list, again, I didn't go through all of those, and that wasn't a comprehensive risk factor list anyway. But I would imagine if we would have kept going, we would have found many more that by this definition are violence. And we know violence exists along a spectrum. Those of us who've done DV work know that even though there may be certain incidences that fit a criminal definition of a DV charge by criminal justice definitions, that frequently those incidences occur as part of a greater pattern of power and control that's a little harder to define. Those of us who do sexual violence work know about rape culture and these cultural myths and narratives that perpetuate sexual harm, that normalize it. And so that I think that we already have a model for looking a little more broadly at a definition of violence. We just maybe haven't looked at it in this way as much in the trafficking movement. So this is a book that I had to read for grad school, and you can get it if you want. It's really dense. It's the kind of book where you read every sentence like 8 times and you're still not sure what's being said unless you already have a theory background. But Black studies scholar Alexander Wahelier points to extreme examples of violence as externalizing the violence that society isn't willing to admit to ourselves. We talk about these extreme examples as if they exist as an exception to who we are. They're an exception to our social norms, but more often than not, they're a reflection of our norms, but at a level we aren't willing to claim as normal. these incidences of violence that are extreme, they're not an exception to who we are. They're an amplification of who we are. And I would say that applies also to human trafficking. If we think about things like mass incarceration, child separation at the border, human trafficking, rape, child abuse, and hate crimes, as someone mentioned earlier, we can point to this as some extreme example, but it's not out of character for who we as a culture or society are. It's an amplification, right? Mass incarceration is an amplification of a lot of the racism that's pervasive throughout the rest of our culture. Child separation at the border, we were all mortified, at least people in my social circles were mortified by seeing that happen. And yet I would imagine that many of you who either are immigrants or work primarily with immigrants recognize that that's just an amplification of practices and beliefs and forms of oppression that you see every day in your work. Human trafficking is an amplification of a lot of exploitation practices that we've normalized in terms of our labor policies and what we accept as normal in this country. And it's the same with things like with rape. Again, that's an amplification of a lot of misogyny that already is existing in this country and a lot of concepts of power and control. And in this book, Habeas Viscus, Wehelier also mentioned some historical events. And he specifically mentions the Holocaust and concentration camps and how we all look at that as if it was some externalized atrocity because it's so horrible we can't wrap our minds around it, but that very few of us go back and look at the 30 to 40 years that led up to that happening to see how it was already escalating. It was already normalized in many ways. That wasn't a shift or an exception to the cultures that it happened in. It was an amplification. And so I got to thinking about that with human trafficking, about this idea of looking at trafficking as if it's an exception to our social norms. And it made me think that means that at some point there's a threshold. There's a threshold at which we say, this is an appropriate amount of exploitation. This is an appropriate amount of force, fraud, and coercion, right? And maybe the threshold's different. Maybe force is here and you can't see my hands because of my background. Maybe force is here and fraud is here and coercion is here. Where is that threshold? Do you know what I mean? Who gets to set where that threshold is? Who has the power to name for a culture where that threshold is beyond which we're no longer willing to exploit people or force them into things they don't want to do or coerce them into behavior or work that doesn't feel safe to them? And why do we only address things that fall above that threshold? To me, it would seem like if we started addressing all the things that fall below that threshold, we could keep that in so many more cases from ever getting to that threshold, right? Our laws, they don't address violence. This is one thing where I'm like, crime and violence are not synonymous. There are a lot of criminal codes that attempt to define certain types of violence or kind of like quantify it. But violence is a whole much broader thing that exists separately. And if we could address that violence that happens below the threshold, we could prevent trafficking. And this is a quote that I heard Deborah Gibbs, who's a researcher at RTI, say, "Many survivors of human trafficking were forced, defrauded, and coerced by the violence of systems and gaps." And I just wanted to name that for us. And so what are we doing about the collective violence of these systems and gaps, and how are our prevention methods addressing this kind of violence? I know I was in a session earlier where they mentioned that awareness is not prevention. I would also argue that criminalization is not prevention. And there's a whole public health field of violence prevention that kind of outlines some shared violence prevention concepts that are the same no matter what form of violence you're trying to prevent. And so this is called the social ecological model. And we have risk factors, and a risk factor increases the likelihood of violence occurring, even if they're not causal. Protective factors decrease the likelihood of violence occurring or increase someone's resilience if they experience violence. And so risk factors and protective factors can be for experiencing violence or for perpetrating it. You can actually usually identify through the research some risk factors for perpetrating violence and reduce those as well. Risk and protective factors exist at each level of this model, the individual, relationship, community, and societal. And so our prevention can target each of these as well. And I know a lot of times we try to talk about getting curriculum in with young people, and this is important. I'm not at all, I'm on a team that authored a curriculum, a sex trafficking prevention curriculum, but that mostly addresses individual and some relationship factors. We need to think about how we can make change at community and society level. How can we create community and society level interventions to prevent violence at those levels as well? Because if we teach kids things and we try to help transform children, and then we send them out, or support children better, and then we send them out into the same community with the same societal norms, we're not going to be anywhere near as effective as we need to be. The CDC calls that outer layer prevention. So outer layer, if you ever hear anyone who's a public health nerd talk about outer layer prevention, what they mean is any kind of prevention work that primarily addresses community and society level norms. And right now, the CDC is really emphasizing the importance of outer layer prevention strategies because they're realizing individual levels only go so far. Right. So, for example, in the RPE grant, which is the grant that I provide TA to all of my state's RPE subrecipients, that's rape prevention and education, and it's CDC funds for reducing sexual violence. They require anyone who gets RPE funding to dedicate at least half of their energy, time, and resources to outer layer strategies. So when you write your grant, you have to show, you know, it's great if you can get a prevention curriculum into a school with X number of middle schoolers and high schoolers and X number of sessions. But if you aren't also doing community level stuff, like a community level prevention task force or social norms change campaigns, you don't keep your funding. And also, if you want to do effective prevention, you need to measure if your prevention is effective. And at one point I did a survey where I invited people to I had them fill out a survey to give me a lot of information to create this human trafficking prevention curriculum matrix. And one of the questions is about whether or not you evaluate your program and whether or not you have an evaluation plan. And one of the responses says, we can't formally evaluate our program because we can't measure who did or didn't get trafficked as a result of our programming. But there's other things you can measure. And so in terms of your curricula, you can measure things like changes in risk and protective factors. You can measure things like shifts in knowledge, beliefs, and attitudes with pre and post tests. But also at the community and society level, you can measure things like who got housed in your community, who got access to substance use treatment in your community, who is distributing harm reduction resources, and you can count the number of harm reduction resources distributed in your community. You can track things like changes in public policy legislation about immigration, LGBTQ rights, racial equity and inclusion. These are all things we can measure. So what else can we measure? And y'all feel free to unmute and name some things that you know that are along this community and society level thing. What are some other things we can measure to check the effectiveness of our trafficking prevention efforts in our communities? And I'm not keeping up with the chat yet, so if someone who sees the chat wants to read any of the responses.
Hey, Chris, can you hear me?
Yeah.
This is Erin, and I'm not going to directly answer your question. I'm going to put something else in here. I would love to see this sort of measurement be the thing that replaces the constant clamoring for prevalent studies. I don't think we're going to have a prevalent study anytime soon. I always find the calls for that to be utterly ridiculous. And my default is always, all right, we don't know prevalence, get over it. What we do know is that we have all of these other things that we can measure that are preventative factors. So let's go to, anyways, that's my plug for getting rid of prevalence.
Yes. Anyone else have measurement thoughts to share?
Sorry, I just wanted to add to the point that Erin brought up. The stagnation that's created by just the regurgitation of prevalence studies, I think it also comes from divorcing that the systems that we're utilizing to combat human trafficking are also the systems that perpetuate this violence. And so if we're still not in a place of 2021 to even reconcile with that or sit with those tensions or look at, you know, scholars or theorists that have been saying this for decades, and we siphon it off to activist language, but it actually should be language adopted across all lenses, then we're going to keep regurgitating that same mode of combating it by creating prevalence studies, and that ultimately just stagnates the field, because there is a form of amplification, but what's largely missed from these discussions a lot is the intentionality, right, of how all these systems that we're utilizing to combat human trafficking are entrenched and active in creating the conditions for exploitation and human trafficking. So I just wanted to add that because that was a really great point that Erin brought up. So
thank you. And also I can't, while I'm presenting, I can't grab a link to this, but on NCCASA's YouTube page, I did a webinar last year called Upstream Same River, Rethinking the Bones of Our Systems. That was actually an attempt to do, it was another one of these experimental presentations where I'm like, I'm not sure how this is gonna go, but it's important. And it was an attempt to kind of look at like how we can use a systems level harm reduction lens in our work, since a lot of us are tied to these systems, right? For now, we need to create and continue visioning alternative systems. And I know that there are a lot of incredible visionary groups being led, especially by Black queer people. I know I live near Durham, North Carolina, and we have Spirit House, we have Alexis Pauline Gumbs, we have North Star Church of the Arts, we have a lot of people doing really interesting community-based approaches to try to create alternatives to these systems. But for now, our grant funding ties us to these systems in a lot of cases. And there are, as Sophie mentioned, there's systems that cause a lot of the harm we want to end, you know, but it's a weird place to be in. So this is just where I was thinking all of these things, we can find funding, maybe not enough funding, for people who are survivors of trafficking. It's like once they've been identified as a survivor of trafficking, they're appropriately pitiable, and we will provide them with all of these things that help them reestablish well-being, trauma treatment, health and medical coverage, substance use treatment, vocational supports. Even if we can't find these things for them, we at least talk about them in a way that says they're deserving of them. But these are all the same things that if we provided in advance of someone being trafficked would help reduce people's vulnerability, their statistical vulnerability to trafficking. Yet we don't normalize them in our culture because we've externalized trafficking as something that's apart from, at which point we're like, this person deserves response and safety. And again, our immediate outcomes, which a lot of times is what people do when they're looking at prevention, they want to measure immediate outcomes because they're low-hanging fruit. They're easier to see, they make us feel good, they make our funders happy. But the reality is some of these longer term, any of the work we're doing at the outer layer is going to be longer term, right? We're not going to see quick fixes for outer layer prevention issues. Those are largely bigger issues that we need to do a lot of buy-in work. We need to do a lot of community readiness. But those long-term outcomes are going to be more impactful, and they're really going to have a better chance of ending trafficking than any of our short-term things that we do. So we need to be thinking creatively about how we can write our short-term outcomes in a way that support our long-term goals. Are our short-term outcomes leading us to these long-term goals that are based in the community and society level of the social ecological model? And so we can do things to shift into more meaningful and impactful prevention. We can do systems advocacy. Every single one of us that is working within one of these systems has access to people and tables and platforms that other people don't have access to. And so we can show we can leverage that power that we have by virtue of the spaces we're in for good through systems advocacy. We can uplift mutual aid efforts. I know there was a really good program that I went to at this conference this year on financial assistance. And so mutual aid efforts are a lot of times very valuable, both in terms of building community and filling systems gap and just shifting our thinking from scarcity to having enough. We can do norms change. What else? I mean, like, so think about what are some of the other things that might be strategies or actions and activities we can do to shift our prevention to be more meaningful and impactful at the outer layer. Does anyone have something you want to name or throw out there? Think about it, you know, over the next few days, think about what's going on in your community and then commit to prioritizing your participation in these at least as much as we prioritize our shorter term goals and activities that are based on our shorter term goals. When we talk about accountability, especially in this country, when we talk about accountability for traffickers who work within the sex trades, there's a lot of talk about ending demand. And we have a lot of calls for harsh accountability. And I'm not a fan of traffickers. I think that goes without saying. As a survivor, not a fan. But I also want to think about accountability for demand. And I want to be like, how do we hold ourselves accountable for supply? How do we hold ourselves, our communities, and our government accountable for the endless supply of unsupported, marginalized, dehumanized people for traffickers to target? How do we hold ourselves accountable for a culture that normalizes desperation and exploitation and harm so much that some youth will grow up seeing that and somehow justify the idea of trafficking others in their own minds? How do we disrupt that? And so be thinking, how can we start bringing this message, the things we talked about today, this different understanding of violence, this different framing of prevention, how do we get this message more and more into the anti-trafficking movement locally and in your state or province or on the national level? Start brainstorming, like, how do we do this? How do we hold our movement accountable for any pieces of the mainstream anti-trafficking narrative that contribute to these forms of violence? And I know this is like, I know Margaret, my colleague Margaret is on here, and Margaret occasionally teases me for being like a big giant thinker who gets excited about concepts. But the reality is none of us fixes the whole thing by ourselves with our big thinking. And if we think that that's what we're supposed to do, we're going to feel overwhelmed and discouraged within this movement. So I think I want to close just by encouraging everyone to remember that no one person or policy or organization is going to end trafficking, certainly none of the systems that we currently have in place. And that what I'm calling on you to do isn't to take on a Herculean task that none of us can live up to, but to think about what your part is. What is it that you personally can do in the circles that you have access to and in your community and in your organizations to start to shift that narrative? Y'all have any questions? And I can actually see the chat again. There's a lot of chat to catch up on. Yeah, does anyone want to unmute and ask any questions or bring another perspective into here, like another piece of it that maybe wasn't in this presentation but you think is important?
A lot of people are saying this in the chat, but I just wanted to say this has been excellent. The way in which you've been framing and naming things that I think feel kind of obvious, but haven't been, has been really, I really appreciate that. So thank you.
Thank you. I think for me, the tricky part is how do we put it into practice? And I genuinely don't know all the answers to that. I try really hard to do the right things for myself and in my circles. So thank you for that feedback. This felt a little bit experimental to me, to be like, what if I just take some weird, obscure text I could barely comprehend when I read it in grad school and try to make it real?
I mean, this is a conversation I would love to replicate with my team. You know, like even, and no matter how and where we operate in the anti-trafficking movement, I think that this is a kind of conversation that can really help people reground themselves and reset the table for themselves.
Thank you.
Yeah, I agree. And I think to sort of answer some of that question, though, someone at the very beginning said something really profound, that like this is an unconventional use of the term violence for a lot of folks in this country. And for those of us that are more immersed in the human rights world, it's kind of normal. But I think the more we can do with our colleagues and our agencies, our community to change that. So it's not such an unconventional use of the word violence. And Chris, you just did an amazing job sort of connecting to that and making it very clear. So just thank you for that. And I think that's part of our battlefront, is to make it, to normalize the use of this kind of conversation.
I will see before I go. Obviously, I am on Twitter. My agency is on Twitter, NC Casa. I am on Twitter. You can find me pretty easily. And then also, I would love to share, for those of you that were curious about that systems level harm reduction, a link to a webinar before the thing kicks us out. So let me see if I can find it and share that link, because it was sort of this concept, but looking more specifically at systems and less at like just broader conceptualization of violence. I'm hoping, I'm looking at the clock and moving fast. There we go, I found it.
Okay.
So here you go, I'll give you that in the chat. And y'all feel free to reach out and continue this dialogue, because I know Erin, any of y'all who know me outside of work, which Erin actually knows me outside of work, know that I talk about this stuff all the time and I'm thinking about this stuff all the time, and we'll join you for Zoom and beers to have a conversation about it. So Kristen, is your hand raised for the question? Okay, well, thank y'all so much. I'll turn it back over to Alana.
Thank you, Chris, for sharing your expertise. This is the end of this session. We do have our closing plenary, so if you all can join that at 3 p.m. The evaluation link is in the chat, but it's also on the profile for this session on Socio, so feel free to fill that out. And thank you, and I hope you enjoyed the conference this year.